Understanding Mpox, a new public health concern. Mpox, formerly known as monkeypox, has emerged as a significant public health concern. It is a viral disease that can spread from animals to humans and also between people. The virus belongs to the same family as the smallpox virus, but typically causes milder illness. Mpox is a relatively rare disease, but recent outbreaks have raised concerns worldwide. It's important to understand the facts about Mpox, including its symptoms, how it spreads, and the available prevention and treatment options. While Mpox can affect anyone, certain groups may be at higher risk. These groups include individuals who have close contact with infected animals or people, as well as those with weakened immune systems. Staying informed and taking necessary precautions are crucial in mitigating the spread of Mpox. Recognizing the signs, common symptoms of Mpox. Mpox typically presents with a range of symptoms that can vary from person to person. The incubation period, which is the time between exposure to the virus and the onset of symptoms, is usually between 6 and 13 days, but can range from 5 to 21 days. One of the most distinctive symptoms of Mpox is a rash that can appear anywhere on the body, including the face, hands, feet, genitals, and inside the mouth. The rash typically starts as flat red spots that then develop into raised bumps filled with fluid. These bumps eventually crust over and fall off. Other common symptoms of Mpox include fever, headache, muscle aches, back pain, swollen lymph nodes, chills, and exhaustion. Some individuals may also experience respiratory symptoms such as sore throat, nasal congestion, or cough. It's important to note that not everyone infected with Mpox will experience all of these symptoms. Some people may have a mild illness with only a few lesions, while others may have more severe symptoms. Mitigating the risk-effective prevention strategies. Preventing the spread of Mpox involves a combination of individual and public health measures. By understanding and practicing these strategies, we can significantly reduce the risk of transmission. One of the most effective ways to prevent Mpox is to avoid close contact with infected animals, particularly rodents and primates. It's also crucial to avoid contact with any materials, such as bedding or clothing, that have been in contact with an infected animal. When it comes to human transmission, the virus can spread through direct contact with the infectious rash, scabs, or body fluids. It can also spread through respiratory secretions during prolonged face-to-face contact, such as kissing, cuddling, or sexual contact. Therefore, it's essential to practice good hygiene, such as washing hands frequently with soap and water or using an alcohol-based hand sanitizer. Avoiding contact with individuals who have symptoms of Mpox is also crucial. Navigating treatment available options for Mpox. While there is no specific treatment for Mpox, several measures can help manage the symptoms and prevent complications. Treatment typically focuses on providing supportive care and relieving symptoms. For most people, Mpox is a self-limiting illness, meaning it resolves on its own without specific treatment. However, some individuals may require medical attention, especially those with weakened immune systems or severe symptoms. Pain relievers and fever reducers, such as ibuprofen or acetaminophen, can help alleviate discomfort. Antiviral medications, such as tecovirimat, TPO-X, may be considered for people at risk of severe disease or complications. It's important to note that antiviral medications for Mpox are not widely available and are typically reserved for specific cases. Your healthcare provider can determine the best course of treatment based on your individual circumstances. Section 5. The importance of vaccination in Mpox prevention. Vaccination is a crucial tool in preventing and controlling the spread of Mpox. The Jynneos vaccine, which is approved by the Food and Drug Administration for the prevention of smallpox and Mpox, has shown to be effective in preventing Mpox infection. The Jynneos vaccine is a 2-dose vaccine administered 28 days apart. It is typically recommended for people who have been exposed to Mpox or are at high risk of exposure, such as healthcare workers and individuals with certain health conditions. Vaccination can significantly reduce the risk of infection and severe illness. If you believe you may benefit from Mpox vaccination, it's important to consult with your healthcare provider to discuss your eligibility and schedule an appointment. Section 6. Addressing misconceptions. Separating fact from fiction. As with any public health concern, misconceptions and misinformation can spread quickly, leading to fear and stigma. It's crucial to rely on credible sources of information and separate fact from fiction. One common misconception is that Mpox is a sexually transmitted infection. While Mpox can spread through sexual contact, it's important to understand that it is not exclusively a sexually transmitted infection. The virus can spread through any form of close contact, including skin-to-skin contact, contact with respiratory secretions, or contact with contaminated materials. Another misconception is that Mpox only affects certain groups of people. Mpox can affect anyone, regardless of their sexual orientation, gender identity, or any other personal characteristic. Spreading misinformation and stigma can hinder prevention efforts and create barriers to testing and treatment. Section 7. Living with Mpox: Support and Resources for Patients. A diagnosis of Mpox can be overwhelming, both physically and emotionally. It's important for individuals living with Mpox to have access to support and resources to help them navigate the challenges of the illness. Healthcare providers can provide guidance on managing symptoms, preventing complications, and protecting others from infection. They can also connect patients with support groups or mental health professionals who can provide emotional support and coping strategies. Several organizations, such as the Centers for Disease Control and Prevention and the World Health Organization, offer reliable information and resources on Mpox. These resources can provide patients with the latest updates on the virus, prevention strategies, and treatment options. Section 8. The global impact of Mpox and the need for collaboration. Mpox outbreaks have been reported in several countries around the world, highlighting the interconnectedness of global health security. International collaboration is essential in controlling the spread of the virus and mitigating its impact. Sharing information, coordinating surveillance efforts, and providing support to affected countries are crucial aspects of a coordinated global response. The WHO plays a vital role in facilitating international collaboration and providing technical assistance to member states. Equitable access to vaccines, diagnostics, and treatments is also paramount in addressing the global Mpox outbreak. International organizations, governments, and pharmaceutical companies must work together to ensure that everyone who needs these essential tools has access to them. Section 9. Mpox in Perspective. Comparing and contrasting with other diseases. Understanding Mpox in the context of other infectious diseases can provide valuable insights into its transmission, severity, and potential impact. While Mpox shares some similarities with other viral illnesses, it also has distinct characteristics. Unlike airborne viruses such as measles or COVID-19, Mpox is not easily transmitted through the air. Close contact with an infected person or contaminated materials is typically required for transmission to occur. Compared to smallpox, which was eradicated in 1980, Mpox generally causes milder illness. However, Mpox can still lead to complications, especially in individuals with weakened immune systems or underlying health conditions. Section 10. The future of Mpox research and advancements. Scientists and researchers are actively working to advance our understanding of Mpox and develop new tools to prevent, diagnose, and treat the disease. Ongoing research efforts focus on various aspects of the virus, including its transmission dynamics, pathogenesis, and potential treatments. One area of research is the development of new and improved vaccines. Scientists are exploring different vaccine platforms and delivery methods to enhance vaccine efficacy and accessibility. Researchers are also investigating new antiviral medications that specifically target the Mpox virus. These medications could potentially shorten the duration of illness, reduce the severity of symptoms, and prevent complications. Section 11. Conclusion. Empowering ourselves with knowledge and action. Mpox is a public health concern that requires our attention and collective action. By understanding the facts about the virus, how it spreads, and the available prevention and treatment options, we can empower ourselves and our communities to stay safe. Practicing preventive measures such as good hygiene, avoiding close contact with infected individuals, and getting vaccinated can significantly reduce the risk of transmission. Staying informed from credible sources and addressing misinformation are crucial in combating stigma and promoting accurate knowledge. By working together, supporting public health efforts, and prioritizing research and innovation, we can effectively control the spread of Mpox and protect the health and well-being of individuals worldwide.